Hey guys, how's it going? This is FixerMed. Welcome back to my ECG Skills Builder Workshop, where I'll be covering all the fundamental knowledge and skills you'll need to read and interpret an ECG diagram in a quick and effective manner. This will be part 7 of my multi-part video series of doing so. So without further ado, let's go ahead and get started on today's content. So I'd like to open up today's presentation by giving some background information on the QRS complex. The QRS complex is marked by ventricular depolarization. A ventricular arrhythmia occurs when the P wave is absent before the QRS complex. This suggests that the impulse likely originates in the ventricles. The Q wave in the QRS complex represents any initial negative deflection. The R wave indicates any positive deflection. The S wave denotes any negative deflection occurring after an R wave. And I have a nice picture to the right to denote what a QRS complex should look like on a typical ECG diagram. Moving on. Next, I'd like to talk about the QRS complex transition point. The transition point for the QRS complex usually corresponds to leads V3 and V4 in its normal position, providing a reference for identifying hypertrophy with the transition shifting to leads V4, V5, and V6. This transition also signifies a clockwise rotation of the heart. Lead V1 is positioned on the right side of the heart and captures electrical activity moving toward it, while leads V5 and V6 are positioned on the left side of the heart and capture electrical activity moving away from them. During depolarization, electrical activity typically moves towards lead V1 and away from leads V5 and V6. We'll be examining this concept of the QRS complex transition point in greater detail as we move along the videos in this series. But just make sure to keep this in your mind for now as we study the QRS complex. Moving on. Next, I'd like to give some general characteristics of the QRS complex. The location, it follows the PR interval. Amplitude, it varies among the 12 leads. Duration, this can range from 0.06 to 0.1 seconds. It's less than 3 small squares on ECG graph paper. Configuration, it exhibits 3 waves, Q wave, negative, R positive, S negative. The deflection, it's typically positive, and it's complex above the baseline, or negative, complex below the baseline, and it can be biphasic, complex both above and below the baseline. Positive deflection can be observed in leads 1, 2, 3, AVL, AVF, and V4. Negative deflection seen in AVR and V1. Biphasic deflection present in V3. Moving on to the next set of content. Next, I'd like to talk about a few of the variations of QRS complexes. Widened QRS complexes can indicate various cardiac conditions such as bundle branch block, premature ventricular contractions, PVCs, and ventricular tachycardia. Additionally, configuration variations may suggest conditions like Wolff-Parkinson-White syndrome. Presence of varying complexes may indicate ectopic impulses. Absence of QRS complexes can be seen in conditions like atrioventricular block and ventricular standstill. All right, let's go ahead and move on. So now let's go ahead and take a look at some recall-based questions to test and see if you retain the information I presented beforehand. On an electrocardiogram ECG, what does the absence of a P wave before the QRS complex typically indicate, and what does each of the following represent? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The absence of a P wave before the QRS complex typically suggests a ventricular origin of the impulse, indicating ventricular tachycardia. On an ECG, the Q wave represents any initial negative deflection, the R wave indicates any positive deflection, and the S wave denotes any negative deflection occurring after an R wave. This combination of findings is consistent with ventricular tachycardia, a potentially life-threatening arrhythmia originating in the ventricles. Therefore, the correct answer is E, ventricular tachycardia, Q wave, any initial negative deflection, R wave, any positive deflection, S wave, any negative deflection occurring after an R wave. Let's go ahead and see why the other answer choices are incorrect. Atrial fibrillation is characterized by chaotic, irregular atrial activity and lacks organized P waves. While it can result in irregular ventricular depolarization, it does not directly cause the absence of a P wave before the QRS complex. Furthermore, the provided definitions for Q, R, and S waves do not align with their typical representations on an ECG. Ventricular arrhythmia is a broad term encompassing various abnormal rhythms originating in the ventricles. However, the absence of a P wave before the QRS complex is not specific to ventricular arrhythmias. Additionally, the descriptions provided for the Q, R, and S waves do not accurately reflect their typical appearance on an ECG. Atrial flutter typically presents with regular sawtooth-shaped flutter waves, also known as F waves, and a characteristic sawtooth pattern on the ECG. The absence of a P wave before the QRS complex is not a defining feature of atrial flutter. Additionally, the descriptions of Q, R, and S waves provided in this choice do not accurately reflect their typical appearances on an ECG. Sinus tachycardia is characterized by a rapid regular heart rate originating from the sinus node. While it may result in a shortened PR interval due to increased sympathetic tone, it does not typically cause the absence of a P wave before the QRS complex. Additionally, the provided descriptions of Q, R, and S waves are inaccurate and do not align with their typical appearances on an ECG. Let's go ahead and move on to the next question. Which leads serve as a reference for identifying hypertrophy and signify a clockwise rotation of the heart? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Leads V3 and V4 serve as a reference for identifying hypertrophy and signify a clockwise rotation of the heart. The transition point typically corresponds to leads V3 and V4 in their normal position, providing a reference for identifying hypertrophy. Additionally, this transition shifting to leads V4, V5, V6 also signifies a clockwise rotation of the heart, indicating changes in electrical activity and potential cardiac issues. Therefore, the correct answer is A, leads V3 and V4. Let's go ahead and see why the other answer choices are incorrect. Leads V1, V5, and V6. Although lead V1 is positioned on the right side of the heart and captures electrical activity moving toward it, and leads V5 and V6 are positioned on the left side of the heart and capture electrical activity moving away from them, this question specifically asks about leads serving as a reference for identifying hypertrophy and indicating a clockwise rotation of the heart, not leads capturing electrical activity during depolarization. Leads V1 and V3. This answer choice includes lead V1, which doesn't capture electrical activity moving toward it, but it also includes lead V3, which is not mentioned in the context of capturing electrical activity during depolarization. Additionally, neither lead V1 nor V3 is specifically tied to serving as a reference for identifying hypertrophy or indicating a clockwise rotation of the heart. Lead V5 and V6. While leads V5 and V6 are mentioned in the passage as capturing electrical activity, moving away from them during depolarization, they are not specifically referenced as serving as a reference for identifying hypertrophy or indicating a clockwise rotation of the heart. Leads V2, V3, and V4. This answer choice includes leads V2 and V3, which are not mentioned in the context of capturing electrical activity. Moving towards them during depolarization, lead V4 is mentioned in the passages corresponding to the transition point and providing a reference for identifying hypertrophy and clockwise rotation of the heart. But this answer choice also includes leads V2 and V3, which are not specifically mentioned in the context of serving as a reference for these purposes. Guys, ignore it when it says passage. It's supposed to say vignette instead. I'll be sure to fix that when I upload these slides at a later date. Moving on. Which leads exhibit a biphasic deflection in the QRS complex? All right, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. Otherwise, moving on now. Lead V3 exhibits a biphasic deflection in the QRS complex, meaning it displays both positive and negative components within the complex. This characteristic is described in the passage where it mentions a biphasic deflection present in V3. Therefore, the correct answer is D, lead V3. Let's go ahead and see why the other answer choices are incorrect. Lead V4 is described in the passage as having a positive deflection observed in the QRS complex, not a biphasic deflection. Lead V1 is mentioned in the passage as having a negative deflection observed in the QRS complex, not a biphasic deflection. Lead V2 is not mentioned in the passage as exhibiting a biphasic deflection in the QRS complex. Lead V5 is described in the passage as having a positive deflection observed in the QRS complex, not a biphasic deflection. Remember, passage refers to clinical vignette, not passage. Anyways, let's go ahead and move on to the next question. Which cardiac condition is not associated with widened QRS complexes? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Atrioventricular block is not typically associated with widened QRS complexes. AV block usually manifests as a delay or interruption in the conduction between the atria and ventricles, leading to a prolonged PR interval on an ECG rather than widened QRS complexes. The passage indicates that widened QRS complexes are associated with conditions like bundle branch block, premature ventricular contractions, PVCs, and ventricular tachycardia, but AV block does not directly lead to widened QRS complexes. Therefore, the correct answer is D, atrioventricular block. Let's go ahead and see why the other answer choices are wrong. Bundle branch block. Bundle branch block is associated with widened QRS complexes due to delayed or blocked conduction in the bundle branches, resulting in abnormal ventricular depolarization. Premature ventricular contractions, PVCs. Premature ventricular contractions can cause widened QRS complexes on an ECG due to premature activation of the ventricles, leading to an abnormal QRS complex. Ventricular tachycardia. Ventricular tachycardia often presents with widened QRS complexes on an ECG as it arises from abnormal rapid electrical signals originating in the ventricles, resulting in wide and abnormal QRS complexes. Wolff-Parkinson-White syndrome. Wolff-Parkinson-White syndrome may present with widened QRS complexes, especially in the presence of an accessory pathway, which can result in pre-excitation of the ventricles and widened QRS complexes on the ECG. Guys, that will do it all for the content today. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. As always, I'd appreciate it if you could leave a like and subscribe to the channel for more videos like this. But if not, this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying. Goodbye.